Magnesium. It's not always the reason your leg cramps keep coming back after 60. And if that magnesium bottle sitting on your nightstand, the one with those big chalky white tablets, looks like the answer, it may be the very thing keeping you stuck in the same cycle. You took it like they told you to, every night before bed, and at 3 in the morning, there it is again. That calf seizes. Your foot locks. You're grabbing at the sheet trying to push your toes back, and you're thinking, how is this still happening? I'm doing everything right. Before we're done, I'm going to show you the one reason magnesium can sit in that bottle, enter your body, and still never calm the muscle that keeps waking you up. But first, there's something you need to hear. Something that should have been explained to you years ago. Most seniors are told that if leg cramps keep returning, they just need more magnesium. The cramps come back, take more. Still cramping, increase the dose. That's the logic. It sounds right. However, and this stopped me when I first saw the data, a Cochrane Database review, updated in 2020 by Garrison and colleagues, looked at randomized trials of magnesium for muscle cramps in older adults and concluded that older adult cramp sufferers appear unlikely to benefit from magnesium supplementation. That's not my opinion. That's a systematic review of the best controlled trials available, which means the real problem may not be how much magnesium you're taking. It may be the form, the absorption, or a mineral imbalance that magnesium alone was never designed to fix. That should bother you, because no one, not the label, not the ad, not even most doctors, ever told you that. My name is Dr. David Collin, and I've spent years looking at exactly this problem. The gap between what seniors are told about magnesium and leg cramps, and what the research actually says. After 60, everything changes, and most people aren't told why. I'll tell you, that's what this conversation is about. If this is useful to you, and I believe it will be, the simplest way to keep getting these explanations is to subscribe. I cover leg cramp relief here in a way most people never hear explained. Now, before I go further, I need to say this, and I mean it. This is for educational purposes only. Always discuss changes with your own doctor. I say that not because I have to. I say it because what I'm about to share could change the way you think about that bottle on your nightstand. And any real change to your supplement routine should happen with your doctor in the room, not without them. Here's the enemy. It's not magnesium itself. Magnesium is an essential mineral. Your body needs it for over 300 enzyme processes. The NIH Office of Dietary Supplements confirms that. The enemy is the outdated, oversimplified, one mineral story you were handed. The idea that leg cramps equal magnesium deficiency. Period. End of sentence. Buy a bottle. Problem solved. That story is incomplete. And because it's incomplete, millions of seniors are stuck in a loop, taking the same supplement, getting the same cramps, and blaming themselves for something that isn't their fault. By the time I'm done, you'll know exactly why your magnesium may not be reaching the muscle that needs it, and what you can do about it starting today. Let's start where the confusion begins. Inside the bottle. The most common form of magnesium supplement sold in the United States, the one most people grab first because it's familiar and affordable, is magnesium oxide. If you flip your bottle over right now and look at the back label, there's a good chance that's what it says. Magnesium oxide. Here's the problem. Magnesium oxide looks generous on the label. It has a high percentage of elemental magnesium per tablet, so it seems like you're getting a lot. But the NIH Office of Dietary Supplements, updated January 2026, states clearly that the aspartate, citrate, lactate, and chloride forms of magnesium tend to have higher bioavailability than magnesium oxide. Bioavailability. That's the word that changes everything. It means how much of what you swallow actually makes it into your bloodstream, into your tissue, into that calf muscle that's locking up at night. So why would magnesium fail if the problem is cramping? Because the form you chose may dissolve poorly in the gut. Research published in the Journal of the American College of Nutrition by Lindbergh and colleagues found that magnesium citrate was significantly more soluble and more bioavailable than magnesium oxide. Some sources estimate that magnesium oxide may have an absorption rate as low as 4%. 4, meaning 96% of what you swallowed passed straight through you. Think of it this way. Imagine you pour water into a plant pot, but the pot has no drainage hole. The water sits on top. The roots never get it. The soil looks wet, but the plant is still dying. That's what's happening with a poorly absorbed magnesium form. The label says 500 milligrams. your calf muscle might be seeing 20. Stop. Listen to this carefully. This is not about magnesium being useless. It's about magnesium being wasted. The mineral is right. The delivery is wrong. And it goes deeper than just the form. After 60, your gut changes. The NIH notes that magnesium absorption from the gut decreases with age. And renal excretion, how much your kidneys flush out, increases with age. So you're absorbing less and losing more at the same time. And nobody adjusted the instructions on the back of that bottle for a 68-year-old body. Wrong form, wrong logic, wrong result. And the cramps keep coming. Now here's where the story gets harder. Because it's not just the form. There are medications that millions of seniors take every single day that can quietly interfere with magnesium. And most people never connect them to the cramps in their legs. Proton pump inhibitors, PPIs, drugs like omeprazole and lansoprazole, taken by millions of older Americans for acid reflux and heartburn. In 2011, the FDA issued a safety communication warning that long-term use of prescription PPIs, typically more than 1 year, can cause low magnesium levels. Not low enough to always show up on a standard blood test, but low enough to matter. Low enough to leave your muscles undersupported. And in 25% of the cases the FDA reviewed, magnesium supplements did not even raise the levels back up. The PPI had to be stopped. Then there are diuretics. Loop diuretics like furosemide, brand name Lasix, and thiazide diuretics like hydrochlorothiazide. These are prescribed widely for blood pressure. And the NIH confirms that chronic treatment with these medications can increase the loss of magnesium in urine and lead to magnesium depletion. Your doctor prescribed the diuretic for a valid reason. But no one told you it could be pulling magnesium out faster than your supplement puts it back in. So now the picture starts to form. You're taking magnesium, possibly in a form that barely absorbs. Your gut is absorbing less because of age. Your kidneys are flushing more because of age. And on top of that, a medication you've taken for years may be quietly draining whatever was left. And then the cramp comes. And you think, I must need more magnesium. But more of the same form, through the same broken delivery path, produces the same result. Nothing changes. Most seniors never connect this to that. Today you will. But the form and the medications, those are only two pieces. There's a third one, and this is the one almost nobody talks about. Your muscles don't run on magnesium alone. They never did. A muscle contraction, the kind that fires your calf into a cramp at 2 in the morning, involves a concert of minerals. Sodium, potassium, calcium, magnesium. Each one has a role. And if one is missing, the whole system tilts. Here's how it works in plain language. Sodium and potassium generate the electrical signal that tells the muscle to contract. Calcium floods into the muscle cell and triggers the actual squeeze, the tightening. And magnesium? Magnesium is the off switch. It helps the muscle relax after the contraction. When magnesium is present, the muscle fires and releases. When it's not, or when the balance between these four minerals is wrong, the muscle fires and keeps firing. That's a cramp. That's what's happening at 3 in the morning. But here's the part no one explains. If your potassium is low, and NANS data analyzed by the NIH shows that a significant portion of older Americans don't meet their daily magnesium or potassium needs from food, then magnesium alone can't do its job properly. The off switch can't work if the electrical signals coming in are already unstable. And the NIH's own fact sheet on magnesium states that severe magnesium deficiency can itself disrupt calcium and potassium levels in the blood. So the minerals don't just work side by side. They depend on each other. Think of it like a 4-legged chair. Magnesium is one leg. Potassium is another. Calcium, sodium. If one leg is short, the whole chair tips. And if you've been adding height to only one leg, more magnesium, more magnesium, more magnesium, while the other 3 stay short, you haven't fixed the chair. You've made it wobble differently. This is why some seniors take magnesium for months and still cramp. Not because magnesium is the wrong mineral, but because magnesium alone can't stabilize a system that needs all 4. And nobody ever framed it that way. Most seniors never connect this to that. Today you will. Now what about food? Because here's where the standard advice falls short again. You've probably been told to eat bananas for potassium, or take a calcium pill, or drink more water. And all of those things can help, in theory. But after 60, even food-based mineral intake runs into the same wall. The NIH confirms that only about 30 to 40% of the magnesium you eat in food actually gets absorbed. The rest passes through. And if your gut health is compromised, if you've had gastric issues, celiac-related damage, or even chronic use of acid-blocking medications, that number drops further. So you eat the right foods, you take the supplement, and the cramp still shows up. Because the delivery pathway is broken at multiple points. The form of the supplement, the state of the gut, the medication that's working against you, and the missing minerals that magnesium needs as partners. And what if the bottle is not the real answer at all? What if the real answer has less to do with what you take and more to do with what your body can actually use? That's the question most seniors never ask. Because the system, the labels, the advertisements, the generic advice, trains you to think in terms of input. Take this. Swallow that. But the real question after 60 isn't what goes in. It's what gets through. And this is exactly where I need you to be honest with yourself, because this is the line where most people either start asking the right questions or keep repeating the same wrong ones. I want you to drop a letter in the comments right now. If you still believe leg cramps after 60 are mostly a magnesium problem, drop the letter A. If you believe the real issue is that magnesium is not being absorbed or balanced correctly with the other electrolytes, drop the letter B. I read every single comment personally. Let me know below. And now, here's the part I've been building toward. Everything I just told you is real, and it matters. But there's something that changes all of it, something almost no one talks about. And once you understand it, you will never look at that magnesium bottle the same way again. The real reason leg cramps return, even after magnesium, is usually not that your body needs more magnesium. It's that the magnesium you already trust is not getting used. It's a delivery failure. And delivery failure after 60 has layers that stack on top of each other in ways that almost no supplement label will ever explain to you. Let me walk you through what I mean. Layer 1, the form. You now know that magnesium oxide, the most commonly purchased form, may absorb as low as 4%. So the bottle says 500 milligrams, and your muscles may see a fraction. Layer 2, the gut. Aging reduces absorption. PPIs reduce absorption further. Chronic gut inflammation can reduce it further still. Layer 3, the kidneys. Diuretics accelerate magnesium loss through urine, and aging kidneys excrete more magnesium naturally. Layer 4, the missing partners. Without adequate potassium, calcium, and sodium alongside it, magnesium can't fulfill its role as the muscle relaxation signal. That is the trap. It's not one thing. It's 4 things stacked. And if you fix one but ignore the other 3, the cramp comes back. Every time. Because the system isn't broken in one place. It's broken in a chain. This is what makes recurring cramps after 60 so different from a cramp in a 30-year-old. A young person cramps. They drink some water, stretch, and it's gone. They have the gut capacity. They have the kidney efficiency. They're not on PPIs or diuretics. And their diet usually covers the mineral spread without thinking about it. After 60, every one of those safety nets weakens. And yet the advice stays the same. Take magnesium. That advice was designed for a younger body. A body that absorbs more, loses less, and doesn't need to think about which form it's swallowing. Your body is different now. It doesn't need louder advice. It needs smarter advice. And here's the consequence when this isn't addressed. The cramps keep returning. Sleep breaks. Night after night, you're pulled awake by something you can't stop. And broken sleep does something to you that goes beyond tired. It changes how you move the next day. Your calves feel uncertain. Your footing feels less steady. You stop walking as far. You stop trusting your legs. And the less you move, the more the muscles weaken, and the more they cramp. It looks right. It isn't. Taking magnesium and assuming the problem is managed, that's not care. That's a loop. And most seniors are trapped in it without knowing there's a way out. I'm telling you this because nobody else in this space will. Not the supplement label. Not the generic internet article. And usually not even your doctor, because this conversation takes 30 minutes, and a standard appointment gives you 7. So what do you actually do with all of this? Because knowing why the old approach fails is only useful if you know what a better approach looks like. This is not age. This is something your body is doing, and we can fix it. Here's the framework. 3 steps. Not a prescription. Not a replacement for your doctor. A smarter way to walk into your next conversation about leg cramps, so you stop guessing and start getting answers. Step 1. Flip the bottle. Look at the back of your magnesium supplement right now, or the next time you're near it. Find the form. It will say magnesium oxide, magnesium citrate, magnesium glycinate, magnesium chloride, or something else. If it says magnesium oxide, that is the form the NIH identifies as having lower bioavailability than citrate, chloride, lactate, or aspartate. That doesn't mean throw it away. It means bring it to your doctor or pharmacist and ask, is this the right form for me? Because the form determines how much actually gets into your tissue, not the number on the front, the form on the back. Step 2. Ask about blockers. This is the conversation most seniors never have. Ask your doctor or pharmacist to review 3 things: your medications, your kidney function, and your stomach acid status. If you're on a proton pump inhibitor, the FDA has warned since 2011 that long-term use can lower magnesium levels. If you're on a loop or thiazide diuretic, the NIH confirms these can increase urinary magnesium loss. And if you have any kidney concerns, magnesium supplementation requires extra caution because the kidneys are the body's main tool for clearing excess magnesium. This is not a reason to stop anything. This is a reason to have one honest conversation with your prescriber. That single conversation could explain why the supplement isn't working. So to be clear, the blocker may not be the magnesium. The blocker may be a medication you've taken for years that was never reviewed alongside the supplement. That's it. Step 3. Stop treating recurring leg cramps as a one-mineral story. I know, every cramp website says magnesium. Every supplement ad says magnesium. But the clinical picture after 60 is broader. Look at your overall mineral intake. Potassium from food, leafy greens, beans, potatoes with the skin on, bananas. Calcium from dairy or fortified sources. Sodium from balanced hydration, especially if you're active or on a restricted sodium diet and sweating more than you realize. And magnesium from the right form, through a gut that can absorb it without a medication quietly undoing the work. The AFP, the American Academy of Family Physicians, reports that up to 60% of adults experience nocturnal leg cramps. And data published in the journal Age and Aging confirms that the problem is most common and most burdensome in older adults. You are not the only one dealing with this, but you may be one of the few who now understands why the standard fix keeps failing. Let me bring this together, because I don't want you to leave here with information. I want you to leave here with clarity. Recurring leg cramps after 60 are often less about taking more magnesium and more about whether your body can actually use the magnesium you already trust. The form may be wrong. The gut may not absorb it. A medication may be working against it. And the other minerals your muscles need may be missing from the equation entirely. Now we fix the logic. You don't need to overhaul your life. You need to do 3 things. Review the form, review the blockers, and review the full mineral picture. Bring this conversation to your doctor. Not a guess, a framework. You now have the language and the understanding to ask the right questions. This is what I would tell someone in my own family, sitting across from me, asking why the cramps keep coming back even though they're doing everything they were told. I would tell them, you weren't wrong. The advice was incomplete, and now you have the rest of it. Your doctor never told you this, but I will, and I just did. Before I let you go, there's one more thing, and this might be the most important part of everything I've said today. If magnesium seems to fail, do not keep escalating the same supplement on your own. After 60, blindly increasing magnesium without reviewing your kidney function, your medication list, and the form you're taking can mask the real issue or create a new one. The answer is never more of the same. The answer is smarter next steps. Recurring cramps after magnesium don't mean your body is broken. They mean the logic was incomplete. Now it isn't. Now that you know why magnesium can fail, there's something else happening. Something that can bring those cramps back at night even when the supplement looks right on the label. It's not about one pill anymore. It's about what happens when you're mixing multiple supplements together and the silent mistakes most seniors make without realizing they're canceling out the very relief they paid for. I cover exactly that in the next video. Watch it now.